Hello, everyone. Hello. Can everybody hear me?
Yeah.
Yes. I can hear you.
Okay.
Can hear you.
I don't know about Dr. Bano.
Can you hear Dr. Bano? No, she was asking if we can all hear her.
Yes.
Yeah,
we can hear you. Yes.
Oh, okay, then let's.
Edo must move forward. Move forward. Backward never. Yo.
Edo Professionals in Diaspora Program is a team of skilled and experienced Edo professionals in diaspora who are willing to use their professional skills to support and effect change in Edo State. The program is designed to...
Hello, everyone. We are back again with Edo Professionals in Diaspora. Today is actually our 6th show since the beginning of this program. My name is Nekpe Obasoge. I'm your host today. Welcome, everybody. And today we're going to be discussing a very important topic, dental diseases, how it relates to heart disease and diabetes. We have 3 healthcare professionals in the studio today. The main presenter of today's program is Dr. Aima Musa Eroje, all the way from the United Kingdom. Hello, can you hear me?
Hello. Thank you so much for having me. Thank you to the team at Edo Professionals in Diaspora for having me. I'm so delighted to be here. I'm excited to, share my knowledge with you guys, and hopefully you can learn something tonight.
Thank you for joining the program today. And you are the main presenter of today's program. We can't wait for this presentation. Thank you. So the next professional today is pharmacist Felix Odije. Hello, sir.
Hi, how are you?
Thanks for joining the program today, sir.
Thanks, guys. Appreciate.
Thank you. So, Dr. Nusakare Obano, all the way from California. Thanks for joining the program today, sir.
Thank you for having me. We are excited to see this, our own young, beautiful daughter present to us today. Like they say in the Edo language, Egbe rame or Sego. So we are expecting to hear from her. Thank you.
Thank you for joining the program today. So before we will start the program, I would like to ask you a few questions about yourself. You are always busy, always in the clinic environment whenever we are on the show. Tell us more about your busy schedule as a medical doctor in California.
As you know, I am a gastroenterologist. So, which means a doctor that takes care of the GI system and the liver. So I'm constantly running from hospital to hospital about somebody bleeding from their mouth, bleeding from their rectum, or having abdominal pain. And 2, I went to medicine to make sure that I serve and not to take. I'm going to say this again. I went to medicine to serve. So I am the servant of the people, just like this young lady. From her behavior shows that she's there to serve people.
Yeah, thank you so much for your services and your hard work, because me too have been following you over these months. Besides everything that you are doing there in California, you still create time to provide services to the people of Edo State because of your sense of patriotism. Thank you so much, sir.
Thank you for having me. Yeah.
Okay, so before we start the program today, I will bring Dr. Aima Musa Eroje. Okay, tell us more about today's program before I pull out the presentation.
Okay, so I just want to quickly introduce myself. My name's Dr. Aima Lohi Musa Eroje. Most people know me as Dr. Aima. I'm a dentist. I'm a general dentist. And today my aim is to just kind of inform you guys about how dental diseases can affect and impact your health in general. I'll mainly be looking at how it can affect diabetes and heart disease or cardiovascular diseases. but I will touch on some other areas as well.
Okay, go ahead. We are waiting.
All right. Well, if you're ready, then I'm ready. I hope you guys enjoy my presentation. Okay, so as I said, I titled the presentation "How Dental Diseases Relate to Diabetes and Heart Disease." I just want to give you a quick introduction about myself before I start. I'm Dr. Imalohi Musa-Roje. Most people know me as Dr. Ima. I'm a general dentist, and right now I'm based in the United Kingdom. I actually graduated last year from the University of Szeged in the south of Hungary. So to all my Hungarian friends that are watching right now, jó estét kívánok, és nagyon köszönöm a figyelmet. But I am also very proudly Edo. I was born in Nigeria. I was born in Benin City. My grandma lives in Nigeria. I have strong Nigerian connections. So wobota to everyone who's listening tonight. And yeah, I hope you guys enjoy my presentation.
Thank you. Ima, I think we'll come back again to discuss about your degree, why you attended the University of Hungary or University of what? What motivated you to take this program in Hungary instead of the UK? Because you live in the UK with your parents, right?
Yeah, that's true.
So can you explain a little bit before we go further today?
Yeah, so after I did my studies I did my A-levels in the UK, and I knew that dentistry was what I wanted to do. But I'm also have an interest in languages. And I didn't know actually any other language, I could only speak English. One of the things I wanted to do was to learn another language. So it was just a case of, I wanted to do dentistry. I wanted to live abroad. So it was just a case of going and having a look at different universities. It kind of gave me a feel of what I liked or what I was looking for, both academically and outside that, learning the language. So that's how I ended up in the south of Hungary, to be honest.
Really?
Yeah.
Amazing. So you can speak the language, right?
Yes, I'm fluent in Hungarian.
Oh my God. Okay, go ahead with this presentation. Then I will ask you a few questions about this later on. So just go ahead. Yeah, here.
Okay. So I just wanted to give a quick overview of what I'm going to be presenting. So I've split my presentation into 3 different parts. First of all, I'm going to be talking about gum disease, or periodontal disease, as we dentists call it. The next part, I'll talk about how gum disease can affect our general or overall health. And then finally, I'll talk to you about how you can look after your teeth and gums. So without further ado, I hope you guys enjoy. So first of all, I want to talk to you about what gum disease is. So gum disease is defined as an infection or an inflammation of the structures that surround the teeth. So depending on the severity, we can group gum disease into 2 different types or 2 different stages. We have gingivitis, which is the early form of gum disease, and gingivitis will progress into periodontitis if left untreated. Both diseases affect the health of the gums, the teeth, and later on disrupt the bone that surrounds the teeth. And usually when the bone is disrupted, the teeth become loose. So this is not what we want. So this is why it's important to know what gum disease is and how you can look after your teeth. So yeah, a little bit of facts for you. If left untreated, gum disease will progress to tooth loss. So you will end up losing your tooth. Gum disease is actually the leading cause of tooth loss in adults. And it's actually the 6th most common disease in the world, which is quite a shocking factor. Not many people know too much about it. So this is what I'm here to kind of educate. If you look at the image that can be shown, I want to show you what healthy, you can see it on the image on the right, what healthy gum tissue looks like. So it's pink in color. It's not red, it's not swollen. Whereas on the left, you can see the image that has gum disease, swollen, outermost parts around the gum. It often bleeds, but I'll go into that in a little bit more detail later. So the cause and progression of a gum disease. Now I found this image that kind of shows the flow of how gum disease progresses, and I've tried to summarize it. So gum disease starts with what's called plaque formation. And plaque is a substance that appears on your tooth after you've had a meal. It's a natural process, plaque formation, but inside the plaque are so many different kinds of bacteria. Now, some of the bacteria live on top of the plaque and they actually help to digest food, but a lot of the bacteria that cause the plaque can actually cause irritation to the gums, and this is what causes the gingival inflammation, or it kind of irritates the gingiva or the gums, and this is what we call gingivitis. So as you can see from image 1, you've got the healthy gum with the plaque accumulating, and it's kind of causing kind of an inflammation, or it's kind of irritating the gums. Now, in the saliva, you have minerals that kind of float around in the saliva, and they will kind of harden the plaque that's on the tooth and cause it to turn into a substance called calculus. And calculus is a hard material or tartar it forms on the surface of the tooth, and you cannot manually remove it. You need to go to a dentist to have it professionally removed. So if you can imagine now, you have a lot of calculus building up on the tooth. This calculus can go below the level of the gum line and start to affect the tissues that surround the tooth, so the ligaments and the bone, and it can cause what's called periodontitis, which is actually the infection of the tissues that surround the tooth. It causes your gums to recede. It causes disruption to the bone that surrounds the tooth and the ligaments that hold the tooth to the bone. So the teeth become loose. And this progression of how the teeth become, in time, the teeth will become looser and looser, and they will, unfortunately, tooth loss occurs. So yeah, that's just kind of like a simplified progression or stages to show the cause of how gum disease will progress. So I wanted to break it down even further because that was a lot of information, but gum disease starts with gingivitis. Now, gingivitis is the inflammation and infection of the gums themselves. It's mainly caused by a build-up of plaque, as I said before. The gums usually in patients appear swollen and red, like the scalloped red gums are very, very typical how a gum disease patient would present in the clinic. Patients will often complain that when they clean their teeth, either by brushing or flossing, that they'll see bleeding. The good thing about gingivitis is that it is reversible if you maintain a good oral hygiene practice, and you can have plaque control and you remove the plaque, then you can actually reverse it. But if you do not maintain good oral hygiene practice, it will progress. And the image below kind of compares how healthy gums and gums look with and how a patient presents with gingivitis. As you can see, the gums themselves are inflamed because of the plaque buildup, because the plaque contains the bacteria that's irritating the gums. So now taking a look at the progression of gingivitis on the left to periodontitis on the right. So this picture just kind of shows what changes are affected. As you can see, you have deeper pocket. There's a lot more plaque that's there. There's a lot more bacteria that's affecting the bone, also the ligaments. So a little bit more about what it is. It's the inflammation that surrounds the tooth. It occurs when the gingivitis becomes worse, and it progresses to involve the structures that connect the teeth to the bone. So the periodontal ligaments, as you can see, are affected. The ligaments, once the ligaments that hold the teeth to the bone are loose, the tooth itself becomes a little bit mobile, and eventually the patient will lose their teeth. These patients who have periodontal disease often present with bad breath. They might complain with a bad taste in their mouth. Their gums are receded, and as I said before, after a while the teeth will become mobile and fall out. So now I want to move on to the second part. I would like to discuss the effect that gum disease has on the general health. I'll mainly focus on diabetes and heart disease, but I just wanted to add about how gum disease can affect the fertility. It has links with Alzheimer's disease, with arthritis, and also with COVID-19. So before I get into the types of diseases, how the diseases have the effect, I want to kind of show you the way scientifically in which gum disease can affect the whole body, because we as dentists say that the mouth is kind of like a window to the whole body. If your oral health is good, then your general health will be good, because the bacteria that cause the gum disease can actually make their way directly or indirectly to other areas in the body and cause secondary damage. And they can do this by 3 ways. Now, I've highlighted the 3 ways, and they're not important. The names of them are not important, but I just kind of wanted to break it down so it becomes a bit more understandable. So the first way is the fact that the bacteria in the mouth can travel from the blood to all different areas in the body, the brain, the heart, the lungs. So this is one way they can cause secondary damage. Because another way is that because the bacteria that are present that are causing the gum disease can cause the body to release some kind of toxins that cause damage to the blood vessels. And this will in turn reduce the blood flow to tissues and organs. And this has so reduced blood flow to the tissues has also a negative impact. And the final way is a bit hard to comprehend, but I'll try to break it down. Basically, it's important to know that end stage or the later stages of gum disease, it's a chronic process. So it means that your body is disadvantaged at fighting a disease because it's already trying to fight gum disease, which is a low-grade chronic infection. It's always there. It's not causing you huge amounts of discomfort, but it's just there, and the body is just trying to fight it. And because it's kind of a stabilized condition, in that it's there and your body is trying to fight it, but you're not feeling it. If you were to become ill, or if you were to have another disease, your immune system is compromised, so it won't be able to fight that second disease more effectively. So in one way, they're kind of working together. Now, I would like to talk about how periodontal disease and diabetes work hand in hand. So first of all, we often say that that periodontal disease or gum disease is the sixth complication of diabetes. Gum disease is, I would quite like to define what diabetes is. It's seen as hyperglycemia, which is elevated blood sugar levels. This is the definition of what diabetes is. It's important to know that periodontal disease or gum disease and diabetes have a synergistic relationship, in that studies have shown that if patients who have bad periodontal disease usually have poorly controlled diabetes, and patients who have a good control of their diabetes usually have a stable periodontal condition. So these things are they work together, and the effects of stabilizing one has an effect of stabilizing the other. And patients who are diabetic are actually 3 times more likely to have gum disease, and vice versa. So it's really important that we understand why this is the case and what we can do to prevent it. So one of the reasons, one of the relationships between them is this molecule called AGE. It's not important to people who aren't dentists what this molecule actually is, but it's important to know that it's basically a hormone or protein molecule that's released in the body as a result of having high blood sugar levels, which is often the case when people who have diabetes, they suffer from high blood sugar levels. And this molecule actually causes an increased breakdown of the alveolar bone. So if we look back at the slides, the alveolar bone is the bone that is connected or surrounds the tooth. And if we have an increased breakdown of this bone, then the patient is more likely to suffer from gum disease, or the effects of gum disease. The teeth will be mobile because there's no bone surrounding or supporting the tooth, so it's more mobile. It also causes an increase of insulin resistance, and we know that insulin resistance is what causes diabetes, or patient to have diabetes. They cannot, produce enough insulin to bring down the blood glucose levels. And it also patients show an increased destruction of collagen, and collagen is needed because it forms bone, ligamental tissue, and connective tissue, all of which are the connecting apparatus of the teeth. They connect the bone to the teeth. So if we can't make collagen, then we're going to have a weaker structure of the supporting unit of the tooth. It's also important to note that patients who have diabetes often have dry mouth. Now, this is also it's also caused by, it's because of the diabetes, because of the high levels of glucose in their mouth, but also some of the medications that some patients who, for example, have type 2 diabetes take cause them to have dry mouth. It's a side effect. And when a patient has dry mouth, it means that they're often prone to dental decay and thrush and fungal infections, which is why that patients who have diabetes, like these are really, really unstable like conditions that you want your mouth to be, because saliva is needed for so many reasons. Caries prevention, it's needed to help digest food, has so many functions, it strengthens the teeth. So it's important to know that patients who, you know, come to the clinic and are diabetic, they might present with a dry mouth, and it's important for the dentist because they need to be able to combat that in some kind of way. So for patients who are diabetic, it's really, really crucial for them to maintain a good oral hygiene, because as the image shows, it's kind of like a two-way cycle. They have to stay hydrated. They should be seeing their dentist many times in the year, at least twice a year, but at least 3 times a year. But the dentists themselves will decide. It depends on how stable and how controlled the diabetes is. It's important for them to have good diabetic control. They need to be taking their medication or insulin regularly, because, as I said, it's a synergistic process. It works hand in hand.
Okay, Emma, before you proceed to the next slide, wait, just go back to okay, let's stop here and ask some few questions. Then we'll go on break. When we come back from break, then we'll go to the session of the heart diseases.
Okay.
Yeah. So first of all, I have my question here. What is the cause of a gum disease?
So gum disease is caused by primarily the bacteria that is within the plaque. After you eat food, after you have any meal, you're going to get plaque that forms on the teeth. The plaque contains bacteria that irritate the gums and start to form. So this irritation kind of widens the space between the tooth or the gum and creates what's called a pocket. And the plaque and bacteria build up within the pocket and break down the material that connects the tooth to the bone, and you end up with tooth loss. So primarily what causes periodontal disease or gum disease is the bacteria that attacking the tissues.
Okay, so what about people that brush their teeth like twice in a day? Is that a kind of a method of prevention?
Absolutely. It's important so brushing not only removes the plaque, but it will remove the bacteria and kind of like restore the relationship of healthy bacteria to unhealthy bacteria within the teeth. And not just brushing, but not brushing the teeth, but also like you can use tools to kind of enhance how you brush. You can floss, you can use interdental brushes, cleaning between your teeth. I will go into more detail in that later, but yeah, all these brushing or mechanically removing the plaque from the teeth, this is going to help prevent gum disease.
Okay, you said that some bacteria in the mouth or in the teeth can travel to other parts of the body.
Correct. Yeah.
And cause damages to the cells, right? So how does that happen? Can you elaborate on it a little bit?
Yes, I can. So if you look at the structure of the tooth, so you can see my mouse that's pointing.
Yeah, I can see it.
If you look at the structure of the tooth, you have the enamel, which is the top layer, and below that you have a layer called a dentine, and inside below that you have the pulp. Now inside the pulp are blood vessels. Now these blood vessels, if you follow them down all the way to the root of the tooth, will connect to a larger vessel. So a small capillary or an artery, and this is basically the communication way through the blood vessels in the pulp. It can connect to another artery or an arteriole or a small artery, which then connects to an even larger artery that supplies blood to the face. and from there connects to an even larger artery that can take blood towards the heart, the brain, the other tissues. So the bacteria can essentially stay within, it goes at the end region of the tooth and travel in the blood towards other tissues.
Okay, so you know what? I'm gonna play the jingle of diabetes that we did 2 weeks ago. Then we'll come back again and discuss about the relationship between dental diseases and diabetes. Okay, so let's play this jingle about diabetes. Then we'll be right back.
Okay.
The Edo Professionals in Diaspora is coming back with the 5th show on Nebo TV this weekend. Date 13th March 2021. Time 7 p.m. Nigerian time and 1 p.m. Canadian time. To present one of the most recommended topics, diabetes. Dr. Adesua Musa Eroje would give a special lecture on the different types of diabetes, the causes of diabetes, obesity and diabetes, the signs and symptoms, and the treatment. She will also present about increased blood sugar, the medications of diabetes, the monitoring of diabetes, yearly eye and foot examination, and diet. Join us this weekend on Nebo TV. A phone number will be provided to call in and ask your questions.
Okay, welcome back, everyone. So right now we're gonna go to the dental disease and diabetes session.
Okay.
The diabetes session, and then we have a doctor on our midst here, Dr. Taye, all the way from the United States. Hello, can you hear me?
Hi, yes.
Thanks for joining the program today. Yeah,
Oh,
thanks
you're
for joining the program. So, so far we have been discussing about dental diseases and the relationship to diabetes and heart diseases. So, can you please tell us more, a little bit about this relationship between this dental disease and diabetes? People were, person like me, I was curious. I said, how can dental disease have any relationship with diabetes? Go ahead. Can you hear me? Hello? Oh, okay. Maybe she cannot hear. She cannot hear us. Okay. Emma, Dr. Emma, you can take the question.
Yeah.
The question I just asked. Yeah, go ahead.
The relationship between dental disease and diabetes. Well, the main link is gum disease or periodontal disease, as I just explained. There are so many different ways. So if I go back to my lecture, patients who have high blood sugar release a molecule or a protein called AGE, and AGE will cause the breakdown of alveolar bone. And alveolar bone is the tooth, that is the bone that surrounds the tooth and supports it. So if you don't have this bone as like a scaffold for the tooth is going to be mobile, which is tooth mobility is end stage periodontal disease. AGE also increases the destruction of collagen, which is needed for the formation of healthy ligaments that support the teeth for healthy bone. AGE will also increase the levels of inflammation markers that increase the insulin resistance. And obviously we know that patients who have diabetes have an increased insulin resistance. So yeah, these are the ways in which periodontal disease can affect diabetes mellitus and vice versa.
Two-way relation. Okay. Patients suffering from diabetes must take good follow agent. Okay. Yeah, go ahead.
Okay, am I able to move on to the next section? Or
sure. Go to the next section.
All right. So now I'm talking about how periodontal disease or gum disease has a relationship between cardiovascular disease. Now, for those of you who are unsure what cardiovascular disease is, there are a group of diseases that affect the heart and the blood vessels. So heart attacks, high blood pressure, these are all the kind of conditions that encompass cardiovascular disease. another statistics there, because I think it's nice to have a perspective of the percentage of things that are increased. So patients who have periodontal disease or gum disease are at a 25% higher chance of higher 25% increased risk of cardiovascular disease. So that's quite high. So it's important. Let's go into some of the reasons and the evidence behind this. So all of my information, by the way, is from papers that I have researched and looked into that are factual and show the correlation between the conditions, I'd just like to say. Be happy to show and answer questions for anyone who wants to, find out more about this. But there are studies that show that periodontal disease periodontal disease can cause a release of inflammation markers and toxins, and these toxins will in turn damage the blood vessel walls so that the blood vessel walls can no longer dilate or widen. And this causes an increase in blood pressure because the vessels have to work harder to pump more blood to the required, organ or to the required tissue that's needed. So as a result of gum disease, they can also be hypertension or high blood pressure. This release of inflammatory markers will also damage the blood vessels themselves, and it will reduce blood flow to the heart. So as I said before, that you have a reduced blood flow to the heart. So if you have a reduced blood flow to the heart, then your heart is not getting as much of the nutrients that it needs. So it's not going to be performing at 100%, which puts a strain on the heart and makes the heart more makes the patient more susceptible to heart disease because it's not working at its full effectiveness or effectivity. The periodontal bacteria, so the bacteria that causes gum disease, can also directly enter the blood and travel to the heart. And once in the heart, it can cause secondary infection by actually infecting the tissues or the valves or the chambers, and it can cause a secondary infection. And this is known as a disease called endocarditis. So it's just an inflammation or an infection of the heart, which has started from actually the tooth. So it's very, very, and this is actually really important for dentists. It's often why dentists will ask patients if they have any heart conditions, if they are taking any kind of medications, or if they've had heart surgery within the past few years. It's very important for dentists to know, especially if they are going to perform like dental surgery, surgical extractions, removing teeth, or any kind of periodontal or gum surgery, anything that's kind of gonna pierce the gums. It's really important for dentists to know if the patient is at risk of endocarditis, because there are measures that dentists can put in place to stop endocarditis happening, because it's quite a serious condition, it's deadly. Gum disease will also increase the risk of developing an atheroma. Now, for those of you that don't know what an atheroma is, it's just it's an obstruction that's formed within the artery, and this means that the blood within the artery is not flowing as effectively as it can, because it's kind of like a clot. And so the blood to the heart, or it can happen in the actual arteries of the heart, so the coronary arteries. If the coronary arteries are starved or they're not getting as much blood as they need, then the heart can't perform effectively, and this can be like the single cause of a heart attack. So it puts the patient at greater risk at a heart attack. And how do we know this? Scientific papers and science has shown that there's actual evidence of the presence of the bacteria that causes gum disease within the atheroma of an examined patient or an examined heart arteries. So yeah, there's evidence for the link between heart disease and gum disease.
I never knew anything like that existed.
Yeah. So the next topic is how periodontal disease can affect the fertility. I'll start first with males, and then I'm going to move on to how it can affect female infertility. So with men, there is evidence of erectile dysfunction in patients who suffer from gum disease. These patients are actually 2.85, another statistic, 2.85, so more than twice times likely to suffer with erectile dysfunction problems than patients who don't have gum disease. And it's basically because of an impaired blood circulation. So if we break this down, as I said, the bacteria, the presence of the bacteria that cause gum disease, they release molecules, or like small molecules, that impair the blood supply. So they reduce the blood supply. So you have an impaired blood circulation to the male organ, and this causes problems with erectile dysfunction. Obviously, this has a negative impact on fertility, but there's also evidence that has found periodontal bacteria within the semen of infertile men. So this is also kind of a proving or a factor that nods towards the fact that there is a link. It's not all bad news, because if you maintain, studies have shown that there is a really good prognosis. So if the patients will, get on top of their periodontal health, they'll go and visit their dentist, their hygienist, at home they have good oral health care, then these problems do tend to go away. And what the study that I looked at showed a 50% chance increase of conception. So this is a really, really good number. So the outcome of the treatment is quite high and positive.
I never knew there's any correlation between dental disease and erectile among men.
Yeah, it really is like my teacher always used to say that the mouth is just a window to the whole general health, and as you're seeing, like it's so true.
So dental disease can lead to male fertility or hinders infertility. Yes, infertility.
Correct.
Oh my God. Okay.
So now we'll talk about the fertility problems that gum disease can cause with females. So first of all, it's the fact that there are altered chances of conception in patients who have gum disease, because periodontal disease or gum disease will interfere with ovulation. So the periodontal bacteria and the presence of them within the blood circulation can cause an inhibition of some of the hormones that are needed to ovulate. And obviously we know that ovulation is a key step or stage that is essential for conception to occur. Periodontal disease also lengthens the time needed to conceive by 2 months. So it's also something to note, like if people are struggling to conceive, then gum health might be linked. There's also the fact that it may alter the development and birth of the child, because the bacteria that cause the periodontal disease or the gum disease can enter the blood, cross into the placenta and affect the fetus there. It can cause fetal toxicity because of all the toxin. Like obviously the bacteria are not good for the fetus, they're toxic. It can cause them to be born prematurely, so born early, and often it can cause a low birth weight in the born child. So yeah, this is the link. And there's also links between periodontal disease or gum disease and Alzheimer's disease. It's quite new research, but the results are quite significant. For those of you that don't know what Alzheimer's disease is a disease that affects the brain, and it will effectively destroy the brain cells in time, and it will affect the memory, the thinking skills, and the ability to perform simple tasks. So we call it a debilitating disease, which basically means that it gets worse and worse with time. Now, the evidence, it's believed that the bacteria, again, you're going to see that the mechanism for these things they're recurring. I feel like I'm repeating myself a lot, but you'll get a better understanding as I keep repeating, but the mechanism is the same. The bacteria that cause gum disease will enter the blood, travel to the brain, and from there they contribute to the development of Alzheimer's disease. P. gingivalis is a bacteria that's quite aggressive, and it lives in the mouth, like it's found in the oral cavity, but it's a big contributor to gum disease. And scientific evidence has shown that there is high levels of P. gingivalis within the brain tissue and in the spinal fluid of the saliva, and also in the saliva of patients who suffer with Alzheimer's disease, suggesting that there is a link there. And there's also an enzyme or a protein called gingipains, and it's made by P. gingivalis. It can be found in the brain tissues, and P. gingivalis will increase the number of amyloid plaques. And we know that amyloid plaques are what cause Alzheimer's disease. So this is also the link there. Periodontal disease or gum disease also has links to rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease. It's a long-term. So the body, basically, it's a long-term condition that affects the joints, and it causes joint pain and stiffness. In rheumatoid arthritis, the body kind of doesn't recognize its own joints and starts attacking them, and this is very, very painful experience for patients who suffer with arthritis. They're always in a lot of pain. It's not a nice disease to have. So the mechanism for the link, or the evidence of the link, shows an antibody called ACPA. It will trigger an immune response or a flare-up of arthritis. And patients who have, so from the evidence that I've done, it shows that patients who are who do have gum disease, they have high levels of the ACPA antibody or protein, and which means that it's kind of working together. So if you have high levels of ACPA produced by gum disease, your body is going to attack your joints, and you're going to have episodes or flare-ups of your arthritis. So this is how they're working together. There's presence of periodontal activity in the synovial fluid, so the fluid between the joints that kind of lubricates them. The fact that they're there kind of shows that there is some kind of relation between the two diseases. Rheumatoid factor, which is a protein, has also been found in the dental plaque of patients who have gum disease. So that suggests that there's some kind of link there. And it's also important to know that the gum disease, just like with diabetes, gum disease and arthritis work together. So a flare-up of one will cause a flare-up of the other. If you have less flare-up of the arthritis, you have less flare-up of the gum disease. So that's why it's kind of important, because although with an autoimmune disease, you cannot control when you have a flare-up, what you can control is your gum condition. So if you have a stable or stabilized periodontal or gum condition, then you're less likely to have a flare-up of rheumatoid arthritis. And the statistic I read, I didn't write it down, but you're 8 times more likely to have periodontal disease if you have rheumatoid arthritis, and vice versa. So it's worth knowing, and worth knowing that if you can control your gum disease, then you'd be in less pain.
How can we avoid this gum disease that can spread to other parts of the body? You see, we don't treat this type of disease so seriously in our society, because gum disease is just after all, it's not dangerous, it's not a cancer, it's not this.
Exactly.
We don't take it too seriously. But from your presentation right now, I realize that this can cause serious problems.
Yeah,
right?
And that's one of the reasons why I wanted to, I'm happy to be here to give this information, because it's not widely known. People just kind of ignore like a toothache, or they ignore the fact that their gums are bleeding. But you wouldn't really, I just want to pose the question that if you fell down and you cut yourself and you were bleeding, you wouldn't ignore it. You would at least wash the wound and dress it. So it's the same with the gum health as well. That's what I can encourage you to do. Now, in answer to your question, I do have a section coming up later that I'll speak in depth about what you can do to, have good dental hygiene at home, or dental hygiene to keep gum disease at bay. I could go into it now, but I would prefer to talk about it in full, because it forms the last section of my presentation, if that's okay with you.
Yes, sure. Yeah.
Okay, so finally, I wanted to put this in because it's very topical, but there is new evidence the paper was released last year that suggests that there is a link between COVID-19 and gum disease. And the paper, I would quite like to summarize it. It basically suggests it has evidence that shows that when patients were admitted with COVID-19 and the patients that actually had a confirmed case of COVID-19 and ended up in ICU, like intensive care units, and they had to go to hospital and their coronavirus worsened, they actually had poor periodontal or poor gum health. Now, the thought process behind this is that the bacteria, it's possible that the bacteria from the mouth that cause gum disease can provide a good surface for COVID-19 virus to attach to. And sometimes when they can enter the saliva, and sometimes if you, for example, you cough or the food goes down the wrong way, you can actually inhale or aspirate the saliva, and it can enter the lungs. And we know that the lungs is where the COVID virus actually attacks. It's a attack on the respiratory or the breathing system. So the lungs is where this virus thrives. So this is like very, very new evidence, and the research did say that more research is necessary, but I just wanted to put it in because it is topical and there is evidence. So like if you can do something and keep your teeth clean and maintain good oral hygiene, and you were to get COVID, then there's evidence to show that you're less likely to be hospitalized or for your COVID symptoms to, progress into something that's really, really deadly, just by looking after the health of your gums. So it's worth knowing. Okay. And now to answer the question of Miss Neckpen, I'm just going to be talking about how you can look after your teeth and gums.
Yeah, Dr. Iba, I don't want to interrupt you too much. Someone left a comment in the comment section saying, Miss Neckman, please, can you please ask her the solution to that problem? It's like people are concerned about this because we never knew that gum disease can even lead to infertility among
Of course. And it's natural. It's totally natural to read this new information and worry, but I will cover that. So you can, in summary, you can, help your dental condition by looking after your teeth and your gums. And that is and the good thing about the early stages of gum disease is they are completely reversible. Even though the later stages might not be reversible, you can get them to a condition where they can be stabilized. So I don't want you guys to, read and process all this information and think like, oh no, I'm doomed, because that's not the case. Care at home, professionally and at home, you can do a lot to, if you take good care of your teeth and gums, you can stabilize the condition or reverse it. So I just want to emphasize that it's not all bad news. It's important to know. It's important to know that there's something you can do. But now I'm going to talk about what you can do to kind of reverse or stabilize the condition that you might find yourself in.
Yes, this is the point that everybody has been waiting for. Go ahead and tell us how to prevent this trouble.
Okay. So there are two main things that you can do. The first would be regular visits to your dentist or your dentist, and your dental hygienists. I want to point out that many people, dental hygienists are so important. They're an important part of the dental team. They have such a huge scope of practice. They're able to, they really, really focus on your periodontal or gum health, and they really, really work together so well with the dentist to build your oral health to a point where, your periodontal health or your gum health to a point where it's actually quite stable or even reversed. So if you ever get the chance to, see a hygienist, I would really, really recommend you to take it, because it's all about teamwork, and it's all about, utilizing the skills of the dentist and also the hygienist. Like they have to work well together. So regular visits to the dentists. Now, how regular really depends on the condition that you have. But I would say if you're going to your dentist, at least go and visit your dentist at least once a year, because then your dentist will be able to tell you how often they are recommending you to go and visit your dentist. So try and time that time, because it's quite often that patients forget. It's very easily done. Try and time it with a birthday or the calendar year or the new school year. Like, try and time it with a specific event. Set a reminder on your phone to just go to the dentist, because the dentist is not just checking, they won't just check the health of your gums, but they'll check the health of your teeth. They're checking for oral cancers. They're checking your soft tissue health. They're checking the health of your jaws. It's a really comprehensive exam when you go and visit your dentist, and they'll be able to diagnose things. They have radiographs and all sorts of instruments at their disposal to kind of diagnose what could be wrong with you orally. And you might, it really, really, really can turn someone's life around. So we say patients who have gum disease every 3 to 6 months. So that would be three times or twice a year. You should be visiting your dentist or your dental hygienist. The dentist is able to diagnose the gum disease, and even the hygienist can as well. And they will be able to tailor make a routine for you. So they'll be able to tell you how often, you should be going to visit the dentist, and then hygienist after that, how regularly you should be seeing your hygienist. They'll tell you how you should be brushing. They'll look at the way in which you're brushing your teeth. They'll tell you how you should be brushing. They'll recommend to you kind of different toothpaste that you might need that fulfill your needs. So yeah, it's really, really important. And again, I just want to emphasize, it's not just about gum health, it's about overall health. They're screening you for cancer. They're checking your teeth. They're checking for any abnormalities in alignment. So it's really important that you go to your dentist. Now, if you have gum disease, what will the dentist focus on? What can the dentist do in clinic? So what they need to do is to remove the plaque and remove the plaque retentive factors. So plaque retentive factors are factors or things on the tooth or things in the mouth that can cause the plaque to stay on the teeth. It's important to note that plaque will always, every time you have a meal, plaque will always build up on the teeth, but you at home can brush that plaque off. But what they can do, when the plaque calcifies, when minerals in the saliva will calcify the plaque, it becomes tartar or calculus, and calculus sticks to your teeth, and it's not possible to manually remove them at home. So it's important that a dentist will remove them in what's called a scale and polish. They have special instruments that they use to actually manually remove the calculus buildup from the teeth. So once the calculus is removed, then the bacteria is removed, essentially. Another thing, so plaque retentive factors is not just tartar or calculus. Sometimes the patient presents in the clinic and they present with a filling that's slightly underfilled or slightly chipped. Or slightly overfilled. So think of a step having like a negative part and a positive part. This makes a really good, surface for plaque to actually hide into and reside. So this might mean that they need to do a filling. They might need to remove any high spots, or they might need to build up the parts, the negative steps or the positive steps, to make a smoother surface that plaque cannot retain in. The same can be said for crowns and, dentures that don't fit well. These are very much plaque retentive factors. Yeah. So dentists will try and, manually remove them. Another thing that dentists will do, which is quite recent, or hygienists can do it, is guided biofilm therapy. Now, it's an amazing therapy that uses warm water, airflow, and like a small particle or powder to remove the tartar or calculus buildup from the teeth. If ever you get the chance, I would really recommend you going to remove it, especially if you have dental implants. Actually, studies have shown that this is the only way that the implant should be cleaned. So yeah, if you ever get the chance to, have a look at or have a play or have a go with guided biofilm therapy, this is the gold standard currently. So this is something else. Yeah, fluoride treatment.
Dr. Anna, let's go on a break. We're going to be right back, okay?
Of course.
I hope we'll come back. We'll discuss more about how to protect our teeth from gum diseases, the treatment and everything. I have some few questions to ask.
Okay, that's fine.
Edo must move forward. Move forward. Backward never.
Edo Professionals in Diaspora program is a team of skilled and experienced Edo professionals in diaspora who are willing to use their professional skills to support and effect change in Edo State. The program is designed to give opportunities to Edo professionals in diaspora who are concerned about the plight of the people to voluntarily use the skills, wealth of knowledge and experiences to provide support to individuals, families, groups, and communities in Edo State. In the same vein, Edo citizens in diaspora can equally benefit from the program. Their primary goal is focused on providing online and physical support to Edo citizens, such as healthcare services, donations, online programs, professional trainings in engineering, finance, social services, physical support, training and donation of computers, and more. Let's join the state government to move Edo State forward. The program is scheduled to commence in January 2021 in collaboration with Nebo TV Canada and
Okay, we are back. Welcome back, everyone. So, Dr. Aima, are you there? Okay.
Yeah, I'm here.
So, yeah, let me bring Mr. Felix to the screen.
Okay.
Let's see what he's going to say about this. Hello, Mr. Felix, can you hear me?
Yes, I can hear you. How are you?
Yeah, I'm fine. Go ahead. So far, you have been listening to the program. Know that you are busy. You're always busy. We'll discuss about your busy schedule later.
Yeah.
So
Thank you.
Yes.
Thank you.
So,
So I'm sorry, I have a patient in the clinic.
I know.
So,
Yeah.
first of all, I want to thank our guest today, Dr. Eroje, Musa Eroje, and Dr. Taiwo. Dr. Taiwo, thank you guys for coming. I know as doctors, I know how much you're supposed to be earning this period, you know. First of all, I want to say thank you, our young daughter. Wonderful. I love your British accent. Honestly, I love it. Anyway, so far it is everything is fine. The presentation is so fantastic, and I'm surprised that for a woman that that is plying her trade in the Western world is still able to do a presentation that will be able to furnish every category of our people. She has said it all. People with poorly controlled diabetes are at greater risk of dental problems. So the first thing is you have to make sure you take your medical condition very seriously. And then if you know you have diabetes or there are symptoms, some of those symptoms that she is going to dwell on, you need to see the doctor in the first place, and you need to see your dentist. Once you are diagnosed as a diabetic patient, you need to go. The first port of call is your dentist, because they are more likely to be gums and bones infections in diabetic patients than the ordinary people. And if the bacteria from the plaque happens to now attack your gum and the bones of your gum, then that's a problem. And I also really want to be thankful for our young lady for telling us that the relationship between the dental problem and erectile dysfunction.
Yeah.
That our men today listening to this, tell your colleagues, don't put everything on your wife, that your wife is a witch or doing something, or suspect you of having a side chick. That is why she's doing something to make sure that you are not able to behave as a man, you know. So this could just be a problem that you have. So if you are in that category, we love you. Nobody is jeering at anybody. Go visit your dentist and seek help and get help. Thank you so much. I also want to, if we could probably allow our wonderful doctor from the state to introduce herself and tell us something.
Yes, that is what I'm about to do right now. Let me bring her to the screen. Hello, Dr. Taiwo. I thought it's Taye before. I was calling you Taye. Can you unmute yourself, or did I unmute yourself from your side? Unmute yourself.
Okay, can you hear me?
Yeah.
We can hear you.
Yeah.
Oh, hi.
Hi. Thanks for joining the program today.
Hi, how are you?
Tell me.
Yeah, can you give us a little bit background of yourself and where you are in the United States?
I'm in Toledo, Ohio.
Oh, okay.
I'm a general dentist here in Toledo. I have my own practice here. I'm a
You
general
worked yesterday?
practitioner. And I see patients on a daily basis. I'm from Benin.
Oh, from Benin.
Yeah, well, I lived in Lagos, so everybody calls me Taye Kehinde, but my Benin name is Oheosa.
Elsa, yeah, Benin woman. Yeah. Yeah. So so far I was amazed with some of the information today that dental disease can lead to infertility, erection problem among men. Oh my God, I never knew something like this is going on in this world. So so far with the presentation that Dr. Aima has given us, so tell us your insights and your contribution. We want to hear from you as well.
Dr. Aima did a fantastic job.
Thank you.
She couldn't have said it better. But it's a problem a lot of us, especially those of us from Africa, tend to forget. All we do is go into the dentist, we have a toothache, we need the tooth pulled. They don't realize that the gums are a very important part of it. So a lot of times you see a lot of us going to the dentist, by the time we get to the dentist, we have already progressed into periodontal disease. The teeth are loose, they are falling out, there's somewhat bone loss, and everybody's like, oh no, it's just the teeth, the meat we eat, or the bones we chew. That's why our teeth are like this. But we find out that to prevent this, just the daily toothbrushing and flossing alone can take you, or even prevent you from getting gingivitis, which is the first sign of gum disease, and can just stop a whole bunch of stuff. Because once you progress into gum disease and get into periodontal disease and you start losing bone, then you're now thinking about surgery to correct that bone loss. And the surgery is painful, it's expensive, and 90% of the time it's not effective. So it's better for us to have the prevention and make sure we're brushing twice a day and flossing. And so that way we stop the problem from progressing or getting worse. So,
we don't treat dental diseases so seriously. That is why I was so surprised that bacteria in the mouth or dental disease can lead to heart disease, affect other parts of the body. So that is why we have to take this dental care so seriously, especially those of us living in Africa. So right now we're going to continue with the presentation. Dr. Aima, are you ready?
Yep.
All right, now.
Okay, so we were talking about what you can do to look after your teeth and gums to treat the gum disease, and we established that you should be going to your dentist if you are diagnosed and you have periodontal disease. You should be going every 6 months, or anyway, you should be going at least twice a year, and then from there your dentist will be able to tell you how frequently you need to go to the dentist. So we also talked about that if you do have gum disease, I'm just recapping that one of the ways to remove the calculus that builds up on the teeth, the dentist will be able to manually remove the calculus that builds on the teeth, because it can't actually be done at home. Once the plaque has hardened or calcified, then there's no way that you can manually remove it at home without special instruments. So the dentist will use a special instrument to remove it. This instrument is called a scaler. It can be electronic or it can be manually done by hand, just to remove the buildup of calculus or plaque on the teeth. Another way in which these plaque retentive factors, so calculus is a plaque retentive factor, if I'm referring to the lecture. Another way is by a process called guided biofilm therapy, which is quite a new, very minimally invasive way to remove the buildup of scales or tartar. Basically, what this is, it uses warm water, airflow, and a fine powder to kind of blast off the buildup of tartar. Really, really effective. And actually, studies have shown that this is the only way that you should be cleaning dental implants. So if you have a dental implant, this is like the gold standard of how to clean it. I would just recommend, if anyone ever got the chance to try guided biofilm therapy, to go for it, because it's a really effective way at removing plaque buildup. We were on to fluoride treatment. Now, fluoride is needed because it strengthens the tooth structure. So the enamel, which is the outermost layer of the tooth, fluoride will strengthen that. So fluoride is something that if you're young and you, fluoride can be given at home, but dentists can also use a special fluoride varnish to apply topically to the tooth. And they do this in a special way that the tooth has to be 100% dry. So this is why the dentist will actually give additional fluoride to, treat your teeth and strengthen them. It can be done, it's often done when the teeth start erupting. If you're a child, you might see something that's called, like, a special paste might be placed on top of the tooth. And this is just a fluoride varnish. It might be called a fissure sealing or special coating. It just coats the top of the tooth, and it contains fluoride, which infiltrate into the structure and incorporate themselves into the tooth structure just to harden them and strengthen them even more. Now comes the most important bit, which is the home care. I want to emphasize looking after your teeth at home. It's so important, because actually studies show that the dentist will do about 20% of the work, and 80% of the stabilizing of your periodontal condition is done or maintained by you, the patient. Now, the dentist will try to motivate you. They'll try to tell you and instruct you how you should be brushing, when you should be brushing. They'll give you different adjuncts and things that you can use to improve your oral hygiene. But if you go home and you don't do anything, then your gum disease will only progress. It won't get better, and it will get to the point where you can't reverse the condition, and you'll end up losing the tooth. So I just want to stress that this could actually be the most important slide of the whole presentation, that looking after your oral hygiene and doing the work can actually, help with the healing process and actually reverse the gum disease, and, then have an effect on your general health. So for all of those who are asking me, what can I do to, reverse these conditions, and don't have access to going to the dentist, please pay attention, because here I'm going to tell you what you can do at home. So I've kind of broken it down into the steps I would personally take as if I was cleaning my own teeth at home. This is the order I would clean my teeth. So first of all, I want to talk about interdental cleaning. Now, interdental just means between the teeth. And this is just cleaning between the teeth. Now, there's so many different ways that you can clean between your teeth. So the gold standard, we say, are interdental brushes, which are small brushes. I've pointed them out here. You take them, they come in different sizes, and the size that you get depends on the gap between your teeth, or how much space you have between your teeth. Can be as like size you have from size 0 to maybe size 4 or 5, and they just go up by a few millimeters, and you just take them and brush between your teeth. I wish I had my teeth modeled so I could show how to actually brush, but you're just brushing essentially between your teeth, because if you don't brush between your teeth, this is a very it's a very easy area for the bacteria that you can't see to go between and start building up the tartar or the calculus that contributes to the gum disease. So this is really important. If you do not like interdental brushing, or for some reason you can't use them, you don't know how to use them, you need a dentist to show you how, dental flossing could be the next best thing. So this could be we all know what dental floss is, but some of my patients don't actually like using floss, so they'll use what's called floss sticks. They haven't mastered the technique of how to floss between their teeth, so instead they're using these small sticks to kind of clean between the teeth. It's a lot easier because you don't have to put tension on the floss, and so a lot of my patients find it quite effective and easy to do. You can also use what's called, I haven't written it down, but it's just came to me now, there's a device that you can buy. It's called a water pick. It's basically blasting water at pressure between your teeth. And this is enough to sometimes remove the buildup of, it can remove food debris, it can remove plaque and calculus that's stuck between your teeth. So it's really good for patients who have crowns, bridges, these kind of dentures on their teeth as well. It's something that it's a little bit more on the expensive side, but it works effectively. I just want to point out that interdental cleaning does not replace brushing your teeth. These all have to be done together. Like, all these steps have to be done together to maximize your periodontal or your gum health, and to make sure that you're brushing or cleaning your teeth at the best of your ability. I want to point out tongue scraping. So tongue scrapers, they can be plastic, they can be metal, they come all in different shapes and colors. Essentially, think of tongue scraping like you're hoovering a carpet. So if you leave it, then bacteria build up on your tongue, can stay there, and also it freshens your breath. So yes, relatively newly introduced into people's routines, but the more we know about it, the more I can't help but, advocate it. If it's going to make your breath fresher, then why not use it? But again, I want to stress that this needs to be done as part of a routine and not, replacing brushing your teeth. So toothbrushing, arguably one of the most effective ways that you can perform good or maintain good oral hygiene. So ideally, there's no kind of going around about it, but I want you to brush your teeth using a fluoride toothpaste. This is the gold standard, in my opinion. There's also the debate of electric toothbrush or using a manual toothbrush. Now, what I will tell you is, in my professional opinion, if you tell me that you're brushing your teeth twice a day and you're doing it effectively, then it doesn't matter if you're buying the most expensive toothbrush or inexpensive. I just want to know that you're brushing your teeth correctly twice a day. So, and you can do so you don't actually have to think like, oh no, electric toothbrush is better. Electric toothbrush is advantageous because of the way that the toothbrush head will rotate, so that it means that you are cleaning your teeth more effectively, and you're not cleaning your teeth. You're not kind of going horizontally to brush your teeth, because horizontal brushing of your teeth can actually wear your tooth material away and cause what we call cervical or cervical lesions. So small, it just means that you're wearing away your tooth because you're not brushing correctly. If you have a handheld toothbrush, you should be holding your toothbrush at 45-degree angle to your gum. And you should be brushing, when you're brushing, you should actually be touching partially on your gum and partially on your teeth. You should be brushing in a circular motion all around and all different surfaces. You should be brushing for 2 minutes. So split your tooth into 4 kind of quadrants: upper left, upper right, lower left, lower right, and brush each quadrant, every surface, for 30 seconds. So it's all 2 minutes in total. It's important that you're brushing twice a day, in the morning and in the evening. You can do more if you want, but we recommend twice a day. And you need to be changing your toothbrush every 3 months. This is so important. And if you have an electric toothbrush, you should be changing the toothbrush head every 3 months. Easily done. Set a reminder on your phone. My friends who follow me on social media, I always remind them with like a funny, meme every the beginning of every month. Good morning, friends. Have you remembered at the end of in April coming up? Good morning, friends. 3 months have passed. Have you remembered to change your toothbrush yet? Silly things that we sort of forget, but are going to cause better oral hygiene. Now, the mouthwash can also be, once you finish brushing your teeth, it's also advised that you do not rinse your mouth. You just spit out the toothpaste. You don't rinse your mouth, because you want the fluoride that you're taking in to have a good effect on your teeth. Like, fluoride is needed to strengthen the teeth. It makes the teeth stronger, more resistant to acid attack as well. So if you think about it, if you wash your mouth or you drink something straight after brushing your teeth, you're washing away the fluoride, so you're not having that effect of your teeth being strengthened. So how much fluoride should be taken? The amount of fluoride, I've done my research, and these are like estimate measures. You should be, for me, if you're brushing your teeth with fluoride toothpaste, like, this is the gold standard. So if you're under 3 years of age, you should be have a fluoride content of 1,000 ppm. Do not exceed that, and it's just a smear size, amount that you can use to brush your teeth. Between 3,000 and 6,000, it's the same 1,000 ppm, but you're just using a pea-sized amount. And after 6 years, this increases to 1,500 ppm of fluoride. Now, for fluoride intake, it's a tricky one because I think the best thing to do is to see your dentist. They'll be able to have a look at your teeth and tell you how much fluoride. There might be instances where you might need more fluoride. There might be instances where you need less fluoride. I cannot tell you the exact. I've just put like the recommended allowances. So I just want to point that out. It's worth seeing your dentist. And if you have any more questions, asking about the fluoride intake that way. Now, the use of mouthwash. So it's split 50-50 between dentists whether mouthwash should be used or not. For me, in my personal opinion, I think that mouthwashes can be a really good tool, a really good adjunctive tool to your oral hygiene. However, if you are going to use them, make sure you use them at a different time to when you brush your teeth. This is because if you use it at a different time, then it just kind of goes back to what I say about the washing of the fluoride. You're actually then, adding a small amount of extra fluoride sometimes, and you're not washing the fluoride off, because after you've finished brushing your teeth and you use mouthwash, you're washing away the fluoride from your mouth, and obviously you're not getting the effects of strengthening your teeth. So you can, if you decide not to use it, I don't think it's the end of the world. But if you do, then just remember that you should use it at a different time to when you're brushing your teeth twice a day. So that's another thing. And now I'd like to open the room to any questions. And thank you for your attention. I know it's been quite a long presentation, but I hope you guys got something out of it.
Well, this is an outstanding presentation.
Yes,
and
sir.
For
Sir.
those of us, yeah, go ahead. Yeah.
I wanted to play this video, then we'll come back and elaborate on it. Dr. Ima, I want you to also pay attention to this video I'm going to play right now.
Of course, yeah.
To start, center your brush on the gum line and angle the bristles at a 45-degree angle. Apply gentle pressure so the bristles slide under the gum line. Gently vibrate the brush while you move it in short, circular, wiggling motions. Brush 1 or 2 teeth at a time, then move to the neighboring teeth, allowing some overlap. Use this method to brush the insides and outsides of all the teeth. To brush the backs of the front teeth, tilt the brush and make several up and down strokes. Then brush the chewing surfaces of the teeth with a gentle back and forth scrubbing motion. End by brushing your tongue and the roof of your mouth.
Okay, so yeah, go ahead, sir. I just want to play that video to tell people how to brush their teeth. Some people don't brush their tongue. That's why I played the video. Okay, so go ahead, sir, Dr. Bano.
Yeah. One question that came up, I think it was yesterday, was regarding chewing stick and salt.
Yeah.
Can you comment on the chewing stick and salt? And I know sometimes in Nigeria, some people use charcoal.
Yeah.
Also to brush their teeth, they grind the charcoal and use it, and then I think it's cleaner. But one of the, I would like you to just comment on that. Yeah.
Okay. I just want you guys to, I'm going to give you guys my, professional opinion. So for those of you who are watching that don't know what a chewing stick is, in certain parts of the world, it's a stick that people use and they chew on it until it becomes a pulp and it cleans their teeth. Like I also had to, go and educate myself on it when that question was asked. So what I can say is that my, knowledge about it is limited. What I can tell you is that personally, I've never used a chewing stick. I am aware that, a large population of Nigerians, it's available and readily available to them. I think that frankly, having a chewing stick using one is better than not cleaning your teeth at all. However, I would say that it's better I can recommend, the use of a fluoride toothpaste. This is for me, the gold standard of what you can use, because not only with chewing sticks, you are mechanically removing, you know, the dirt and the debris from your teeth, but you don't have the added protection of fluoride to your teeth. So brushing your teeth with a toothbrush and fluoride toothpaste is what I would recommend, because it's also strengthening your teeth as well. Another thing I can say about the chewing stick is that, you know, the chewing against the stick, it might cause, you know, abrasion to the tooth, which is a kind of tooth wear that we can see. This can be disadvantageous because it can lead to, you know, tooth sensitivity and discoloration and poor aesthetics. But again, I want to point out that my knowledge of the chewing stick is quite limited. So I would trust the science that I am sure of, and I know that fluoride toothpaste work if you have access to one and you can, you know, use that to clean your teeth. That's what I would recommend as a dentist that you be doing to clean your teeth. You wanted me to mention charcoal. Now, I know that many people use charcoal or charcoal containing products for whitening purposes. Like, this is the big advantage that people say. I can tell you that this will only remove surface stains, and in my opinion, this is not what I would recommend if you want to, you know, have teeth whitening. The best way you can do that is to go and, you know, speak with your dentist that can tell you what your options are. Charcoal will only remove surface stains, it won't remove deeper stains. So yeah.
So let's go to the question session. Madam Obaseki, ma. Hello, ma.
You've been reading it. Why don't you just continue?
Yes, ma. Is there any question in the comment section?
She just answered the one that was important. There's a lady here, Endurance Upuma. I think you've been asking her questions. So she said one that vitamin C and fluoride are the same thing. Is that true?
No, that's not true. Vitamin C is an essential, it's a vitamin, or like basically vitamin C is an element or a vitamin that it's needed for, it helps your gums and your connective tissue that's around your gums. It keeps them strong, and it's a really good thing that you can do to prevent gum disease. So foods that are rich in vitamin C, think of orange food. So like you have sweet potato, you have carrots, you have oranges, clementines, these kind of foods that are rich, so rich in vitamin C, spinach, fruit and vegetables. It would be really good adjunct to, you know, strengthening your teeth. Now, fluoride is a mineral element that, so how can I put this in a way that you can understand? Vitamin C helps you with the connective tissue formation, but fluoride is incorporated into the tooth structure to strengthen the external structure of the teeth. It makes the teeth more resistant to acid attacks, and it actually strengthens the enamel, so the hard outermost surface of the tooth. It makes it more resistant to dental decay. So they're two different things. Both are essential for, you know, good dental health, but they're not the same.
Okay.
Oh,
then there's another. Oh, Jesus.
Okay. You have another question there, ma. Go ahead. Is there any question?
Good. Yeah, there are questions. He said, is it always possible for the dentist to manually remove tartar?
Correct.
Or can it be too firmly cemented to the teeth?
No.
Like for removal?
No. It just needs a special sharp instrument that dentists are trained to know how to remove. So I would, the best thing I would suggest is to go and visit your dentist, because they are trained, they know how to use these sharp instruments to remove the calculus or tartar buildup.
Interesting.
Yeah. I learned something.
Then you spoke about mouthwashes already. Somebody was asking about Listerine, which is a mouthwash.
I'd quite like to make say another thing about mouthwashes. There's a debate amongst dentists that say that alcohol within the mouthwash will disrupt the harmonization of good, positive, and negative bacteria. So within your mouth, because in your mouth you have some bacteria that are actually good and they help with the digestion process. So if you are, going to get a mouthwash, I would recommend that an alcohol-free one. And also, as I said before, I would recommend you to use it at a different time to when you're brushing your teeth, so that you can get the benefits, but you're not removing the fluoride content.
Okay. Then somebody is asking about the link between gum diseases and some other diseases, particularly Alzheimer's. How much is the correlation and how much is causation? Is the science on the link mature?
As I said, when I did my, research, this is relatively new. I was reading papers that were published from, 2015, 2018, 2019. So this is relatively new information. Definitely more research needs to be done. I cannot give you a positive, like this is 100% factual, but it's obviously an interesting, it's an interesting topic to place there, and the evidence that has been peer reviewed and assessed suggests that there could be a link. So that's why I thought it was worth mentioning.
Thank you. And then another person was still asking about chewing stick and removal of plaque, which I think you explained.
Yeah. Like chewing stick will remove plaque, it will remove the food, but you don't have the added benefit of it being fluoride and it's abrasive. So if you can use a fluoride containing toothpaste, if you're an adult, pea-sized, and make sure you're doing it twice a day.
Okay, yeah, let me bring Dr. Taiwo to the screen. Dr. Ayman, I just want to ask her, because she has the experience from Nigeria, right, with this chewing stick and plaque in the teeth. How can you use chewing stick to remove plaques from the teeth?
Well, several studies have showed that chewing stick actually does the same job as the toothbrush does, and especially in places like Nigeria, where the cost of the toothbrush and the toothpaste is expensive. So people tend to find it better using the chewing stick, and the chewing stick also has chemicals.
Oh,
which
okay.
Yeah, it also, and there are so many different chewing sticks depending on what country you're getting them from. They have them all around the world, and the chewing sticks all have different chemicals, and they claim that the chemicals in them will do the same job like the fluoride does.
Okay.
So yeah, we say use your toothbrush and your toothpaste, but at the same time too, the chewing stick is good enough, but it still has the problem that even with the chewing stick, you find that a lot of people still get gum disease because they're not flossing, they're not doing the adjunct services that you need to do with that. So
yeah, we would have shown something about how to floss your teeth. I couldn't find a video now, lay my hands on any video. I would have shown people, because some people are not aware of how to floss their teeth, especially in the evening, because whenever we go to the dentist here in Canada, they give us some floss in the dentist office, so that we can use it every evening before you go to the bed, or anytime you can also use it. But in Africa, Nigeria to be precise, I'm not sure if people even understand what they mean by this flossing of the teeth. And it's very important in terms of keeping our dental care and everything, managing your dental disease. So Dr. Ayman, if you have anything to add to the discussion, go ahead.
What I would say is that if you are really struggling to floss, there are, YouTube videos that you can, Google, and they will show you how you can use it. The best way I would recommend is, if you can, try and visit your dentist. Your dentist will be able to show you how you can floss, what you need to do. But what I can do is I can find a good video, or I can create a video myself. I can send it to, Miss Neckpen, and she can share it. I'm happy to do that, just to teach guys. If people want to know how to do it, then I'm happy to help. So.
Oh, okay, yeah, Dr. Emma, you know what you will do? Please create a video, kind of a jingle format. So whenever we're having shows, I will play it in the middle of the show, just to give people awareness of how they can take care of their tooth. Then it's okay. Then it's okay. Yes. Thank you, Dr. Emma. Dr. Obano. Okay, let me bring Dr. Obano. So,
can I say something?
Yeah, go ahead, Dr. Anna.
I think I remember Dr. Obano asked me a question about reflux, or was I imagining that? I didn't.
Yes.
About the reflux and the tooth. And then my next question was for you to comment on tetracycline during pregnancy and tetracycline for little kids, mostly in Nigeria, where antibiotics sometimes can be an issue, where people I don't want to use inappropriately, where people prescribe from lack of knowledge of some of this stuff.
Okay, so tetracyclines are part of an antibiotic group, and if they are prescribed to a woman that's pregnant or a child under the age of 12 years old, then it can cause, deformations within the structure of the tooth that can lead to a discoloration. And so this is why usually if you're pregnant and you need antibiotics, we as dentists or, clinical professionals or doctors or even, pharmacists should not prescribe tetracyclines to, these select groups. So children under the age of 12 or pregnant ladies, because of the discoloration. Now, in the case that this has happened, what can we do? So as a child, to be honest, the main focus will be keeping the structure of the tooth as healthy and as sound as they possibly can. So this is where, like before, I talked about, the additional fluoride, high fluoride containing toothpaste, and professional use of the fluoride varnish. There are certain different toothpaste that have high content, for example Durafat, Mi Paste Plus, tooth mousse, that can be used to keep the teeth as strong and healthy as possible. That patient or that child would be probably visiting their dentist regularly, updating on the changes, but I think the focus would be to maintain, the strength of the teeth and the health of them, keep them as healthy as you possibly can, until their jaw has grown. Once the jaws have grown to their full size, usually about the age of 18, I wouldn't do anything spectacular until the age of 18. I think the concern becomes more about the aesthetics and how it looks. Then we can talk about, veneers or composite bonding or bridges or crowns or dentures to, give a better aesthetic result and improve the appearance. So this is the treatment modality that I would go down. Or I'd like to just point out that it is preventable. It's just a case of, knowing of when you know that, your patient is pregnant or is a child, you should just know already in your head, like tetracyclines is a medication that I'm not going to, prescribe or give to them.
Thank you.
Interesting. Thank you, Dr. Emma. Wow. How many years have you been practicing this profession?
Well, this is, I graduated in June 2020, so actually 7 months. But I have, I feel like when I went to university, I've been extensively trained. I've been seeing and treating patients now for over 4 or 5 years. Like since, our second year, we were treating patients, we were examining patients just to get ourselves familiarized, with like the dental environment, and like the thought process behind that was by the time we leave, we feel equipped and ready. And I honestly say that I do feel equipped and ready, and I, can, acknowledge or know when something is above what I can do, and then try and refer on to, get them the best help that they can.
A few years of experience, but I just imagine the way you are explaining it, and your presentation is so long. It just shows that you are very determined and you are focused with this profession. Thank you so much. Thank you for what you are doing. Dr. Obano, do you have anything to add to this?
I think she has given what I call an A+, and I think our brother Felix will agree with me today. Presentation. She has touched
Mr. Felix,
every
we agree
aspect.
with you. Only Mr. Felix, we agree with you. What about me? What about me? What about everybody?
I see Felix there enjoying himself and shaking his head and just taking in the presentation. Like the tetracycline explanation she gave was excellent. And I see our brother Felix just nodding his head and says, what an outstanding dentist, a young dentist we have speaking today.
Thank you so much.
So this program continues to bring quality speakers, begins to bring people that are well informed in their field, not just anybody who stands in front of the camera to talk. And also, I really want to commend both parents of this young lady who has input discipline in her and show her with guidance how things should be done. So I am very, very proud of both parents. And I hope as we put this program on, the Edo people will continue to look at these young people we bring in and evaluate their homes and their children.
Yeah.
So today, you see that President Biden has appointed so many young people in spite of his age into his cabinet. And I hope our brother Godwin Obaseki should look at these young people and bring them on as his advisor on issues like dental guideline for the state, COVID treatment for the state. These young people can generate guidelines that will help those of us as we get in our 80s and 90s to be able to survive in our state.
Yeah. Mr. Felix has
yes, thank you. I just want to thank our guest, Dr. Taiwo and Dr.
Aima
Lohi. Yeah, so, and I also want to speak to the girls, the ladies, the women in Edo State. You don't have to, because you're a woman, doesn't make you disadvantaged in any way. You can see our guests today, and that should inspire you apart from the message that they came on the screen to give today. Inspired to just aspire to get the highest form of life in terms of profession and other endeavors. Thank you so much, our guests. And I also want to tell our people that people with poorly controlled diabetes are at greater risk. So if you have diabetes, between your family physician, the doctor and the dentist and other professionals, you can live as long as you want and also maintain the integrity. Your teeth will also have better chance of having good oral hygiene, oral condition as just like the normal people. Thank you.
Thank you.
Thank you, Nickman, for hosting us. I want to thank Mrs. Obaseki for being our backbone. She's an unsung hero. She works behind the scene for the success of this program. Thank you, everybody.
Thank you. God bless you.
Thank you to Mr.
There's a lady or a man here, Osasona Obaseru. He said, this is laudable program, informative and educative. Indeed, health is wealth. There are so many accolades like that. Like everybody's saying, hi, I learned something. Thank you, everyone, for taking.
Yeah.
There are just so many things. Awesome. This is wonderful. I learned so much and all of that. So we are very proud of you. This is an awesome presentation. I thank you, Dr. Taiwo Ungo, for coming. We really appreciate you and God bless you. And God bless everybody.
Thank you.
Thank you.
Dr. Ayman, thank you.
We're very proud of
Thank
you,
you so much.
Yeah.
Thank you.
Thank you,
I'm sure
guys.
your grandma will be very proud of you watching tonight.
Thank you.
You're
Thank
welcome.
you for that
And
wonderful.
everybody, not just your grandma, everybody watching is very proud of you.
A lot of comments
thorough,
for you.
thorough presentation. We are so happy to have you. Yeah.
Thank you for having me.
Thank you for all your time in preparation and dispensing what you prepared. That was really great. Yeah. Thank you.
Thank you, Dr. Ama. You are such an inspiration to the younger generation.
The younger one.
Right?
Yeah, we are done for today. And in 2 weeks, we'll be presenting other information on medical issues. Like they say in Edo language, Egbe Rame or Sefe. So we will continue to bring this quality presenters to you and to bring young people that are going to be there to impact on those of us who are a little bit older. I personally have been in medicine more than 30 years, but I have learned so much from this young lady today, that things that I never learned before. So I see patients day in and day out with met mouth, diabetic patients with gastroparesis, and so on and so forth. But what I've taken from this young lady today will help me tremendously in my own practice and in my own life as we move on. And I want to take this time to thank Nekme, Felix, Ms. Sobaseki for what we are doing. And I hope Taiwo, Dr. Taiwo being from Edo State, will join us to push the state forward. We are planning to start a diabetic clinic. And this is where we will need hands like Dr. Ima, Dr. Taiwo, to be in a group that can send messages and as well consult from a distance on diabetic patients in Edo State, throughout Edo State.
Yeah.
Please.
Yeah, Dr. Taiwo is from Edo State. And we would like to include you to this, our group of Edo professionals in diaspora. We'll talk about that after the program. So, I think we are done for today. Thank you all for the program. For everybody who is watching right now, all our viewers, our audience, thank you all for following Edo professionals in diaspora. We still have a lot to present in this, our little group. Dr. Obano, I think next 2 weeks, do we have any program coming up?
Yeah, we have a program coming up
to discuss that.
Yes. Yeah, for all the members of the committee, please, you just wait. After this program, we have a quick meeting.
Thank you very much, Dr. Taiwo and Dr. Ima.
Thank
you very much.
Later.
Yeah.
God bless you.
Thanks for having me.
Bye
now.
Bye.
God bless you too.
God bless you. Thank you.